Turning to health and wellness, when it comes to patient advocacy, medical assistant Brandy Andres and licensed practical nurse Candace Brooks are fierce. They spent a lot of their time working with transgender patients, providing a safe zone of ethical treatment for all.
The best nurses advocate for their patients because you're supposed to be your patient's voice. And that's really what it's all about. I feel like it just comes naturally for me to do that.
I love what I do. I wouldn't change it for the world. I've always wanted to work in the medical field my whole life, so I'm very passionate about my job.
Where I want them to feel accepted and I want them to feel relaxed. I just treat patients how I would like to be treated if I was on the other side of it. So I just try to be warm and welcoming and kind of give them that feeling like they're in a safe haven once they walk through our doors, that they can be themselves fully and they'll be fully accepted and respected.
So how do you provide that welcome vibe?
So for me, it depends on the energy that they're giving when they come through the door. Some people are very nervous. Some patients are very timid. And some aren't. Some are, gung-ho, they're ready to go. They're very chatty and, you kind of just feed off the patient's energy. And then I talk to them kind of according to what they're giving me.
So what are some of the ways that you advocate for patients?
We have to advocate for them with insurance companies. We have to advocate for them with the pharmacies. So we're really, the main way that we advocate for them is being their voice where they can't be. Even in this day and age, to the pharmacists and the pharmacy techs and the staff at the pharmacy, the gender care is still very either unknown or, just misunderstood. So you have to advocate for the patient because sometimes they'll just give them whatever they want to give them and won't ask the patient any questions. And then they're dispensing things in the wrong way. And the patient's showing up in our office for a teaching with me and they don't have the correct supplies.
I mean, I'm part of the community, so that makes it more for me. I came from an area where I moved here from South Florida, so it's very dominant. And I have a lot of gender friends and I have a lot of drag queens. So I know I've seen it firsthand. I've gone through a lot of it with my friends. So coming here and working with my provider just made me feel like I was finally able to do something for my community.
What do you want people to most understand about the transgender community?
They have had a very hard life and you just don't understand their feelings. And sometimes you just need to put yourself in their shoes.
How do you provide a safe zone for patients?
You make them feel as comfortable and as welcome as you possibly can. You smile and I have a good rapport with my patients because I talk to them on the phone constantly. So most of them already know who I am. But even for the new ones, you just have to make them feel at ease so that when they do come, they're not as stressed as they would normally be.
Tell me a little bit about what kind of support you offer.
I listen, I chat with them on my chart, and I always offer support and say, if you ever need anything, just call me. I'm always here. So just giving myself to them and saying I'm available when you need me makes them feel a lot better.
And even if you never see them again, they might not remember your name, but they'll always remember how you made them feel, always.
Middlesex Health is really leading the way with sensitivity training. Candace and Brandy say one of the easiest ways to make a person feel comfortable is to pay attention to a patient's preferred name instead of their given name. You're watching Connecticut Voice Out Loud, where we celebrate pride all year long.